What if I told you that cervical cancer is one of the most treatable and preventable forms of cancers? Yet, every year, over 300,000 women die from cervical cancer. Here's how you can stay protected. Hello, guys. Welcome back to my channel. My name is Oyeyemi. January is Cervical Cancer Awareness Month, and today we are going to be talking about cervical cancer, the signs and symptoms, how to prevent it, and all you need to understand cervical cancer. Cervical cancer is cancer of the cervix. The cervix is an opening between the uterus and the vagina, meaning it is the lowermost part of the uterus, and the uterus is the womb, as we all know. Cervical cancer is majorly caused by the human papilloma virus, also known as HPV. Although this is not the only cause of cervical cancer, it is the most common cause. This virus is transmitted sexually. When the body comes in contact with this virus, the immune system initially tries to fight off this virus, but on few occasions it fails and then the virus remains dormant in the body and later progresses to become cervical cancer. This virus can remain dormant for as long as 15 years or even more, meaning a person coming down with cervical cancer now may not have just contracted the virus. The person may have contracted the virus about 20 or 15 years ago, but surprisingly, it's just coming down with cervical cancer. Also, the virus can progress if the person becomes immunocompromised. So now let's discuss who is at risk of coming down with cervical cancer. Anybody who has a cervix is at risk of having cervical cancer. If you have done a total hysterectomy before, where the whole uterus and the cervix were removed, you are not at risk. If you did a partial hysterectomy before, and where part of the uterus was removed and the cervix was left behind, you are also at risk of coming down with cervical cancer. Other people who are at risk of coming down with cervical cancer are immunocompromised people, women living with HIV and AIDS, and also women who smoke. Cervical cancer is very dangerous because in its early stage, it is asymptomatic, meaning somebody can have this cancer and not have any symptom until it progresses to the late stage. And then they now present with symptoms like abnormal vaginal bleeding, which would come as irregular menstrual bleeding, spotting, or even bleeding during or after sexual intercourse, pelvic pain or pelvic fullness, pain during sexual intercourse, and abnormal or foul smelling vaginal discharge. So let's talk about real life scenarios now. Imagine a 60-year-old woman who started noticing abnormal foul smelling vaginal discharge. She has tried treating them using various antibiotics, but it did not work. Finally, her husband got tired and asked her to visit a doctor. On getting to the doctor's office, the doctor asked her some questions and then decided to examine her and also examine the cervix using a special instrument. On examination, he noticed that the cervix had various reddish spots and also wounds on them. So he had to refer her to a gynecologist who took sample from the cervix and sent them for investigation. When the results came back, it was discovered that she had cervical cancer. Let me give you a second scenario. A young woman, let's say in her 30s, just started losing weight for no reason. She was eating right, her diet was on point, but she was still losing weight. She decided to present to the hospital, and then they started suspecting that it may be cancer. But where was this cancer coming from? They did all the workup that they could do for her, all the investigations, and started to check the cervix, only to find out that there are reddish spots and wounds on the cervix. Took sample for investigation from the cervix and sent it to the lab. The result came back and it was cervical cancer. Finally, let me give you a third scenario. A woman in her 60s, she is postmenopausal. She noticed that anytime she has sex with her husband, she starts bleeding during sex or even after sex. She has not seen her period for almost 10 years now. So this is supposed to be abnormal for her. But she felt like, maybe it's just vaginal tear. So she took it lightly. But this symptom, it kept occurring and she just got tired and had to visit the hospital. On getting to the hospital, the doctor asked some questions, same process, did test and discovered that it was cervical cancer. Now, all of these scenarios would have been prevented if these women had presented for screening earlier on. And that is why it is advised that women screen for cervical cancer. This cancer can come in any way and it can come in any form and have any symptom. When you notice your body is a kind of way or you notice that you are sick, visit a doctor so you can get the appropriate treatment. Do not self medicate. For treatment of cervical cancer, if cervical cancer is caught in the precancerous stage, it can easily be treated. If caught in the early stage, the treatment is more aggressive. It is treated with surgery and radiotherapy. But when caught in the late stage, it can no more be cured. So it is treated with radiotherapy and chemotherapy. Luckily, cervical cancer is easily preventable. There are vaccines now that you can take to prevent cervical cancer. The only reason why we still have cervical cancer is because many people do not know about these vaccines. The first way to prevent cervical cancer is by getting vaccinated with the HPV vaccine. This vaccine is given to children as from the age of 9. It is given to both male and female. Male are carriers of this virus, and the virus can also cause penile cancer in them. That is why you give this vaccine to your male and your female children. Women who are not vaccinated or not properly vaccinated up to the age of 26 years can still get this vaccine. So you have to visit your doctor to know if this vaccine is right for you. Also, women who are immunocompromised and women living with HIV also need this vaccine. Another method for prevention is by screening. Screening is done via the HPV test or the pap smear. This screening is done 3 to 5 yearly depending on your age and the result of your previous test. Pap smear is done by collecting samples from the cervix and sending them for histology. This can help you detect if there are normal or abnormal cells in the cervix, and if there are abnormal cells, it can let you know if the cells are precancerous in the early stage or in the late stage of the cancer. Other ways to prevent cervical cancer is to avoid smoking and practice safe sex. Cervical cancer is preventable only if we do the needful. When detected early, it is one of the most easily treated form of cancers. Cancers diagnosed in the late stage cannot be cured. If you have not gotten your HPV vaccine or scheduled your screening, kindly do it today. Cervical cancer is preventable. Like they say, prevention is better than cure. Do not forget to share this video with people you love and people you care about, be it your wife, your partner, your colleagues, your sisters, your friends. Please share this video. It could save a life. Subscribe for more health tips, and together let us spread awareness. Stay healthy. Till we see you in my next video. Bye.